you know, I think you're on to something.
Yeah, just to add to that, yes, we need payment reform, and that's an essential prerequisite, but we need to follow up with three things. One is the best practices, and that's where we think we fit in, because they're going to have to know what to do or how to do it differently if we're going to demand greater performance. Secondly is more innovation. I was very stimulated by that panel this morning to see these young people coming up with these totally new models. Now, historically, innovation has not been our friend in healthcare. In every other sector, innovation leads to better outputs and lower costs and so forth. Historically, in healthcare, it's often led to higher spending and often marginally better outcomes. And a lot of the research dollars has gone into very high-cost treatments, high-cost machinery, and so forth. It increases utilization. So we need to try to drive the newest innovation towards things that improve value. And third, and most importantly, is data transparency. You asked the other panel earlier what would they, if they had a magic wand, what they would do. To me, it would clearly be to have greater transparency of all our cost and outcomes data. And if you think about it, we're spending $3 trillion a year without really any regard to cost or quality, with significant levels of information at the consumer level. And so those are three things we need to follow up on once we establish a better payment regime.
I agree with everything that's said. I probably would dig a little deeper on data transparency to data interoperability, because I think data interoperability